those providers who have very limited time in their offices and their appointments, which is reality of medicine these days. This is why I would say you have to have a team of providers. I don't think one person, one provider can really manage a veteran with TBI, PTSD, or other co-morbid problems. So especially for primary care physicians out there, don't try to do everything in 15 minutes or limited time. I mean, it's perfectly fine for you to tell your patients, you know what, I have limited time. You have I see that you have a lot of problems, which I'll be honest with you, I don't think I'll be able to address everything in this visit, but let's break it down to multiple visits, so we'll address this and let's address other things. At least a patient knows that you actually care. You actually know that there are issues and you want to at least talk to them, but appreciate that you're willing to see them again instead of trying to jam-pack everything in that 30 minutes, 60 minutes. I say this to my fellows or residents that's under my supervision. Don't try to do everything in 60 minutes. They say, oh, how can I do everything you tell me in that 60 minutes or 90 minutes I'm given? Well, don't try to do everything in one setting. That's the goal, but if you only have limited time, just stop and say, let's continue next time. I mean, I learned that from my psychology colleagues. They always say, hold that thought for a moment. That's for next session. And then they move on, and or at least they don't address it. So let's learn from them. So don't go into like, gosh, they have all these problems. Well, let's hold that off for next session. So that's the advice that I'll give to medical providers out there.